Hello and welcome back to Pharmacy Notes. I am here with a new topic, that is how painkillers work inside your body. Have you ever thought, how does a small tablet stop the pain inside your body? Pain is not just a feeling, it is a signal that is sent from different receptors to the brain. So in today's video we will learn how the painkillers really work and how they reduce the pain inside the body. So let's start. First of all, what is pain? Pain is basically a body's warning system. It gives signals to brain that there is something has happened or some injury has happened in the body. So there are special nerves that detect these signals, and after detecting them, they directly send these signals to the brain. And in brain, there the pain is felt, not on the site of injury. And in brain, when the pain is felt and a response is produced by body, and which effector cells carry it to site of injury. So pain is just a message, not an injury itself. Important fact about painkillers. Painkillers are often used to reduce pain, but keep in mind that they do not fix the injury. They only change how signals are sent and how the brain feels the pain. So painkillers can give you the temporary relief from the pain, but they will never cure the that injury. Next, type of painkillers. There are basically three main type of painkillers that we use commonly. Number one is paracetamol. It is also called acetaminophen. Number two is NSAIDs, non-steroidal anti-inflammatory drugs. It includes ibuprofen and aspirin. And number three is opioids, that include morphine and tramadol. Now these three classes have their own mechanism of action, and they work different from each another. First of all, paracetamol or acetaminophen. It is used for headache, fever, and mild pain. It works mainly in brain and makes the pain signals weaker. So it does not reduce swelling much because it does not have inflammatory properties. It is only an analgesic, and it also has an antipyretic. Antipyretic means it also reduces the fever. So it does not reduce swelling because it does not contain the the anti-inflammatory properties. Next is NSAIDs, the non-steroidal anti-inflammatory drugs. These include ibuprofen, aspirin, and many others. When body is injured, it produces different chemicals. These are known as prostaglandins. And what these prostaglandins do, they cause pain, redness, and swelling. So what NSAID do? They block production of these chemicals. And when these chemicals, the prostaglandins, are not produced, in this way they reduce the pain and the swelling. Next, we have strong painkillers, opioids. They are used in severe pain when your NSAIDs are not working, your acetaminophen and paracetamol are not working. Then you go towards the opioids. These are used in severe pain and in surgery pain, usually given after any surgery, and in cancer pain. They work in the brain, they block pain signals strongly, but they also have side effects which include sleepiness, slow breathing, and addiction. People start becoming dependent on these painkillers. Why too much is dangerous? Because all these are drugs and they also have side effects. For example, if we talk about paracetamol, if you take this in overdose, or if your dose is exceeding than the normal dose, then it causes liver damage. Similarly, ibuprofen, that is NSAID, it causes stomach and kidney damage because mainly the drugs are eliminated from the body through the kidney. And similarly, if you take too much opioids, it can cause the breathing issues. So, as I said earlier, painkillers only hide pain. They do not remove the root cause. So, you have to be smart. Use smartly. Use painkillers at correct dose for short period, and use only when needed. And you should not mix medicine with the others and without advice. So, do not take daily without the guidance of doctor or without the prescription. So this video is only for educational purpose. This is just to familiarize you with the different type of NSAIDs and it is not the replacement of any medical device. If you have any issue before using medicine, you should always consult your healthcare professional, your doctor or the pharmacist. Thank you for watching. I will see you in the next video. Until that, goodbye.